Gestational diabetes, pre-existing diabetes mellitus, target for pregnant women, pre-existing diabetes mellitus, target for women planning pregnancy, women at higher risk of GDM, risk factors for GDM, diagnosis criteria for GDM, interventions, postpartum interventions. Gestational diabetes mellitus, GDM, is a condition in which a hormone made by the placenta prevents the body from using insulin effectively. Glucose builds up in the blood instead of being absorbed by the cells. Gestational diabetes mellitus is established when following of the three glucose levels occur in pregnant female. First criteria, fasting more than or equal to 5.3 mol/L. Second criteria, 1 hour glucose test more than or equal to 10.6 mol/L. Third criteria, 2 hour glucose test more than or equal to 8.5 mol/L. Pre-existing DM target for women planning pregnancy, less than or equal to 7.0% of A1C value. Pre-existing diabetes mellitus target for pregnant women, less than or equal to 6.5% of A1C value. Pregnant women at higher risk of gestational diabetes mellitus, A more risk of gestational diabetes mellitus, less than 20 weeks pregnancy, B less or no risk of gestational diabetes mellitus, 24 to 28 weeks of pregnancy. Risk factors for gestational diabetes mellitus, age, more than or equal to 35 years, using corticosteroid medication, pre-existing obesity, pre-diabetic, previous GDM, ethnic group polycystic ovary syndrome. Diagnosis criteria for GDM, preferred approach, 50 grams glucose challenge test, less than 7.8 mol/L, it's normal. If between 7.8 to 11 mol/L, then 75 grams oral glucose tolerance test. Interventions, 2 weeks for behavioral changes, physical activity diet, if target not achieved, insulin metformin, cross-placenta but not harmful, glyburide, not recommended because of increased birth weight, macrosomia, hypoglycemia, acarbose, only one small randomized trial, effective for gestational diabetes mellitus. Postpartum interventions, encourage for at least 4 months breastfeed minimum, breastfeed prevent neonatal hypoglycemia, childhood obesity and diabetes mellitus for mother and child, screening between 6 weeks and 6 months from 75 grams oral glucose tolerance test. Learn terminologies with MJM.